We're using the trigger point cane. We're going to talk about the neck and shoulder. Trigger point cane has different knobs. This is going to release muscle tension and muscle knots. For the neck and shoulder, a lot of the knobs we're going to use that depending on the cane that you have, it has numbers on it, right? If it doesn't have numbers, don't focus on the numbers. We're going to focus on this knob here where it has more of the pointy knob, and then we're going to focus on the round knob. And sometimes for the neck, we'll use these two free flowing points as well. For the neck, a lot of times we will have tension running here from the back of the skull and running down to the top of the shoulder blade. All right. Rule of thumb: whenever before you use a trigger point cane, you always want to use your hands to feel like where you have your tension. All right. So if I feel on my neck here, I feel a spot right here. Usually when you feel a trigger point, it will be hardened. So usually like muscle rebounds. So if I press on a muscle, right, it should bounce back and rebound. But if I press on a muscle and it feels like it kind of feels, it shouldn't, it's not bone, but if it feels like more hardened, that's a trigger point. And if, especially if you have pain there. Also, preference, the trigger point cane is really like a symptomatic tool. If you're having pain, this is good to use. Not something you want to do every day. So with that being said, right here, I feel a little bit of a hardened spot. If I press on it, I feel a little bit of symptoms here. So right here is the neck muscle. So everybody's different. You just want to, like I said, palpate with your hands first. So from here, once I find the spot, I'm going to use the round knob and I'm going to replace my hand with the knob. And I want to get across my body and just replace it. And then right here, I'm applying gentle pressure with this hand. And then this hand, it just stabilizes it. And then I'm going to just apply gentle pressure. The good thing is you control the pressure, but you do want to feel pressure. You don't want to not feel any pressure. Once I find the spot, I'm going to take a nice belly breath in and then exhale out. Nice belly breath in and exhale out. You want to try to aim for about anywhere from 3 to 6 breaths, depending on the tension. Each breath you take, you will see that muscle kind of like shaking up a little bit. That's blood flow stimulating and releasing. Sometimes you'll feel a little pressure in the forehead. That's normal. A lot of times, like these trigger points can cause tension headaches. So when you work on releasing it, it would elicit that response. But once you let go, there you go. Yep, I just got it. There you go. So when you feel the muscle jump, that's a release of tension. So that's one spot. So now I could just move around my neck and just find different spots. So once again, it feels a little bit more hardened right here. So always want to touch first with your hands. So once I find that spot, if I'm working on a spot that's sitting on top of my shoulder, I want to use the round knob, okay? Not this one. And from here, I like to work diagonal. So if I'm working on my right side, I'm going to have the trigger point cane targeted down on my right, but the angle is going to my left. So now I replaced it from my hand. I found the spot right there. And then I'm going to use this hand to push down because it's on sitting on top of my shoulder. So I got to push down. Now I got to leverage pressure pushing down. So this hand is pushing down, this hand is pushing down. And then, yep, right there. I feel that tension. And then I'm just going to hold right here and take the breaths. Yep, each breath you'll feel it. If we have a spot right here, just kind of running down up to the back of the skull, you want to use one of these knobs here. You can use this or you can use this here. All right, so you want to wrap around the cane and then you find the spot. Usually we get a lot of tension here. Now I can just replace it with my finger and then just apply that pressure and take those breaths. There we go. Yep. And then you'll feel like that release. Like I said, sometimes you get a little tension in the forehead. That's okay. Once you release it, it's gonna feel like very lightweight. The last thing for the neck shoulder, let's talk about the medial side of the shoulder blade, which is the rhomboids, the trap. You get a lot of tension here. You can use either the pointy knob or the round knob. If I'm doing my right shoulder blade, I want to come across my left shoulder, and so I can wrap around to get there. So I'm using the pointy knob, and then I want to think about pushing in. I'm pushing in towards my chest. So for this one, yeah, you could locate. Sometimes it's hard to kind of reach in this area, so you can use the trigger point can and kind of get a gauge of where you have tension. So you just do like some light pressure, poking around, and then once I find a spot, okay, right there, I'm gonna take a nice breath in. Now I'm pushing in towards my chest. There we go. There we go. Yep. And then I could poke more up. Usually, like if you could slide up just a little bit, you'll find another spot. And right there, yep. Once you find it, you just want to keep steady on it. There we go. There we go. And then you just keep moving up. And right there is usually a spot. Quick little bonus, if you have some tension here on the outside of your shoulder blade, we call this the lateral border. It's where your lat muscle is. I like to use the round one, and then I just wrap around my chest, and then I target that area. So with this one, you could touch. Sometimes we get a little tension here towards that lat. That lateral border is what we call it, and I just replace it or get into that area. I'm using my armpit to now apply pressure in. So think about like the pressure going in towards the opposite shoulder. So if I'm doing my right shoulder, I want to push into my left shoulder. I'm using my right elbow to help, and then I'm just, that's the spot. And then right here, and this hand is pushing this way to get that pressure. Just explore where you have your tension, but that's the idea of how to get to the neck, the top of the shoulder, and the shoulder blade.